Hello, everybody. My name is Sushma, and today we're going to read more of Kopikar, clinical experience of 70 years of his practice. This was from a speech he read in Allahabad, and it's a story, another story, and I thought I'd entertain you. One Krishnamachari saw me first time. He saw Dr. Kopikar in 1943. You might wonder why I'm reading all these old episodes to you. Folks, human health does not really change. Humans are beset with the same problems now that they did, were with 100 years ago and so on. And things just don't change. And some of these lessons are age-old and worth reading. So Krishnamachari saw Dr. Kopikar for the first time in 1943 from Cuddalore. Cuddalore is a city that's about 100 miles south from Chennai. It used to be called Madras at the time. This area, very tropical, is full of filaria, and he had it in a bad way. Getting the usual fever every fortnight, midnight, and a huge elephantiasis of his leg with sores and blebs. I know of people who had giant legs for years before they died, and nothing ever worked. They tried everything under the sun. So getting the usual fever every fortnight at midnight and a huge elephantiasis of his leg with sores and blebs. I gave him arsenicum album 200 and silica 200, alternately every 10 days. And pulsatilla and belladonna, 30 Cs for the acute phases. Pulsatilla, as you know, is a great remedy for swollen legs, swelling of the legs, varicosities in the legs. Belladonna is for inflammation if it's red, bright red and shiny. And that was used for acute phases. And that also controlled his fevers because it was a febrile disease. Then, as he was far away, I gave him a prescription of hydrocotyl asiatica, which is a great remedy for filarial infections. Hydrocotyl asiatica, 5 to 7 drops, tincture 5 to 7 drops twice daily, to be purchased in a nearby town. He used this regularly without intervals. So this was supposed to be a sporadic treatment, but this person, Krishnamachari, used it every day, twice a day, 5 to 7 drops. It was a wonderful for all of us to see him fit, the leg becoming thinner and healthier month by month. What took many years to happen is by perforce going to take many years to become well again. Thinner and healthier month by month, year by year. He used to pay me a visit once a year in summer and used to bring a huge jackfruit. So people paid in kind, farmers and rice and milk and jackfruit and mangoes. This guy would bring a huge jackfruit carried by a porter from the railway station. A regular pilgrimage for him until his death at about the age of 80 years. It is this method which has helped most of our patients of rheumatic arthritis with severe deformities in joints and stiffness. I think this was the method of Burnett and also others who cured such incurables. For any chronic infection, this continuous treatment seems to have worked very well in these people, given them healing and quality of life. That's incredible, given that no other modality is able to give them this kind of life. Please note that I'm narrating the lessons that I learned and which improved my cure rates as the years rolled by. They're not chronological in any sense. The next lesson, Kopikar says, started in college, when he was in college. Dr. S.K. Banerjee, our clinical medicine professor, read out a chapter called focal sepsis in the test and said that a condition, now in India you get medical training for homeopathy, you get the full MD And you also get homeopathic training. So they are trained in anatomy, physiology, surgery, daily emergency medicine, and all of that, along with the use of homeopathy. So these are qualified doctors. The clinical medicine professor read out a chapter called focal sepsis in the test and said that a condition called acute rheumatism with fever is always a heavy streptococcal infection. These germs are always there somewhere in the body, like tonsils, colon, appendix. So, in other words, it's a chronic disease. There's all sorts of theories about, is this really an infection? What is it? Is the body releasing its toxin? Whatever. These are chronic conditions. Their thesis was it was due to a chronic infection, and they can be for any reason, due to drenching. You got drenched, overwork, viral fevers, etc. The vitality is lowered. These germs suddenly started multiplying, causing even septicemia, acute rheumatic fever, or even leading to endocarditis. How many cases do we know of people with the rheumatic fever, the chronic sepsis stayed in the body, infecting the heart valves, the heart, causing chronic endocarditis? We have the the recent episode of the jabs, which have caused chronic endocarditis, and it's a lot of similar stuff that happens when you have septicemia, which is acute, it's chronic, and it affects vital organs and goes on and on and on. The only remedy for that literally is homeopathy, or even leading to endocarditis. You might know that in those days, for some years, there's a craze for tonsillectomy, appendicectomy. There is still that craze for pulling your tonsils out, for pulling your appendices out, pulling your breasts out, uteruses out. So somehow this did not impress upon my mind. I was going on treating arthritis with the usual bryonia, rustox, sulfur, etc. but not quite successfully in relapses. I did not care about heart complications, but it was routinely checked. So he always treated all these cases as if they were common arthritis and not infectious arthritis. And you have to have some knowledge of the pathology in order to know what is the real condition you're treating, and that is what he wants you to think about. What is it that's really going on? Are you treating a plain joint problem, a joint sprain? Are you treating a common arthritic problem, which might be diet or lifestyle related, or are you treating an infection? So he just treated it with bryonia, rustox, sulfur, etc., but it always relapsed. And so the relapses were not quite as successful. He didn't care about heart complications, but it was routinely checked. The first case that taught me something was my distant relative, a retired officer. His left shoulder joint was painfully swollen. The usual medicines, including ferrum metallicum, did not help. Neither was allopathy doing any better. Mystery. What was it? He was advised to get an x-ray done. He went to his old friend, the best x-ray specialist, who refused to take it, an x-ray of his shoulder. Instead, he took an x-ray of his mouth, of his jaws. There was a large pus pocket in the root of the molar. On his advice, the tooth was extracted. The shoulder got well in a week to 10 days. That is detective work. Even this, he still didn't learn. Even this did not change my method of treatment. Once I had gone to Madurai for a conference and was asked to see a boy, aged about 8 or 10 years, having acute rheumatic fever, being treated by the best homeopath in that city. I was shocked to see his heart beating about 130 to 135 beats per minute. Sometimes an extra systole and a slight murmur as well. I asked them to get pyrogen, which is high heartbeat, low pulse, high fever, low pulse, high fever. Contrasts, typical in infectious diseases in your body. Sometimes and pyrogen is made from rotted meat, by the way. I asked them to get pyrogen 200, also 1 m for future use, and give it in spoonful doses from a tumbler full of solution. That's a few pills in water, and give it in spoonful doses, or a few drops. As usual, as most patients, there was no news at all from them. So once people start feeling better, they disappear, never to be seen or heard of again. 3 or 4 years later, I met the parents and the boy. By now he's 13 or 14 years old, at a wedding in Madras, and then came to know that he had been cured completely by pyrogen alone. It opened my eyes to the streptococcal infections and the influence in rheumatism and arthritis. I get streptococcus in higher potencies, and I'm glad to say it is at the head of the group of medicines, which are sulfur, tuberculin, soranum, and so on, in the treatment and cure of chronic disease. When you have chronic disease, suspect infection, long-term chronic infection. So we really cannot cure the repeated septic tonsils without this great remedy. Please use it more and see. And on that note, the thought I leave with you is anything that's chronic in your body could be a chronic infection that very possibly requires chronic treatment, and thinking about it in a different way than your standard headache or stomach ache or joint ache. The first example was Krishnamachari of Cuddalore, who had elephantiasis, big leg and blebs and pustules and infections on his legs. He got cured from repeated doses of hydrocotyl asiatica, and then this other child, the 8 or 10-year-old, from pyrogen from acute rheumatic fever. And that is Homeopathy Nook for today. Hope you enjoyed it and have a chance to ponder over this until our next meeting. Thanks, and have a great day.